Hello and welcome to Skincare for Hope. It's #Hope series. Now, one of the pillars of Skincare for Hope is educating those with sensitive skin. So we created this webinar series to bring together industry experts from corners of the field and share their insights, perspectives, and tips on skincare and skin health. So thanks for joining us today. Now, since it's November and it's palliative care month, now our video for today will be on skin health for cancer patients with lymphedema. And for the cancer patients watching now, we hope that this will help you in your cancer journey. Okay, hi everyone. Welcome to #Hope series, Skin Health or Skin Health, a quick skincare guide for every age and gender. So Skincare for Hope believes that educating the public on skincare is important to achieve better skin integrity and quality of life. And it's November, it's actually Palliative Care Month. So today we have a very special guest. Thank you for joining us, Mr. Francis Ciabal. So Francis is a lymphedema expert. He's a certified lymphedema therapist, and he's trained by the Dr. Vodder School in Dallas, Texas. He has been in practice for the past 8 years and is an active consultant and therapist at Calambas Cancer Center, the Medics Cancer Center, San Pablo College's Medical Center, and at the Asian Hospital Medical Center. Wow! Welcome, Francis.
Hi, Laura Claire. Thank you for having me here. Pleasure.
Then, so lymphedema is one of the problems of cancer patients. Not many are aware, pero there's so much we can do to help them. Kailangan lang nila ng knowledge. So when you see patients, what's happening ba? When does lymphedema happen?
Well, actually, the most patients that I see are post mastectomy patients. So they underwent radical mastectomy, of course, because of the lymph node dissection and radiation. It actually became a side effect for these patients, and they develop swelling in their arm or even in their limbs. So it's really important that we also address this, not only the cancer, but also the lymphedema as well. That's why we're here to help them.
Totoo yun. Kasi ang dami ring skin changes with the lymphedema. Namamaga yung arm. At the same time, may blisters. Sometimes that blisters can occur. And then pag nagsugat na, pag may wound, it's so hard to heal. Ang hirap-hirap gumaling nung sugat. Kaya kailangan talaga alagaan yung balat. But what techniques do you do to help minimize itong mga lymphedema? Patients with big arms.
Yeah. So once these patients are diagnosed with lymphedema, Tagalogin natin for our listeners, lymphedema is manas. In the earlier days, manas is just ordinary manas. So not a lot of people pay attention to this condition. But since in our modern medical times, lymphedema should actually be treated. No? So for example, for a patient who had radical mastectomy and develop lymphedema, they usually come to my clinic for their initial assessment. So what I do is I also ask them to see a vascular doctor for them to have their venous ultrasound just to make sure that they did not develop any deep vein thrombosis or any blood clots. And once they're clear, they can already start the treatment regimen for lymphedema. And going to the treatment itself, there are actually 4 components in the treatment of lymphedema or the management of lymphedema. Yes. So the first one is MLD or manual lymphatic drainage. So manual lymphatic drainage is just like a massage, yeah. But it's a very specific targeted massage wherein we work on their lymphatic vessels. And as you very well know, the lymphatic vessels is just underneath the skin. So we use a very light pressure wherein we guide.
Parang linilift
yes,
lang siya.
That is correct. So we guide the lymphatic flow to the other available lymph nodes. So if a patient was operated on the right side, we can always assume that the lymph nodes were also taken out surgically. So incompetent na yung side na yon to drain the fluids. So I manually guide the fluids to the other lymph nodes or to the other kilikili. Also, we also have lymph nodes in our abdomen and in our groin area sa singit. So we also try to drain the fluids going to that area since hindi na nga pwede yung affected kilikili nila. So that's the first component, manual lymphatic drainage. Second is compression therapy. Now, a lot of patients would say, namasahe mo na ako, na-drain mo na yung fluid. So why do I still have to use compression? Yes, the wrapping. In fact, I have a sample here.
Oo nga. Gano'ng kalaki ba yun? Wow.
So this is a improvised arm. I just used a PVC plastic. And so this is basically how I wrap the arm of my patients.
Yes. Hanggang daliri, no? We wrap even the fingers.
Yes. So they ask me, Francis, bakit kailangan pa ako mag-compression therapy? Well, the reason for that is you can only imagine a 3-story house wherein the shower is pretty much ano ba yung word na yun? Malakas ang tubig sa first floor. But then when you go to the second and the third floor, medyo mahina na yung pressure. Medyo mahina na yung shower natin. So ang ginagawa ng mga engineers, they put in pressure pumps. So just like compression, after I do the therapy or the massage, we apply pressure so that the fluids will flow upwards.
How long does the bandages stay there?
Usually after the therapy, and then I see them the following day, I take out the mga 24 hours. And then we do the therapy again, and then we bandage again, and paulit-ulit lang naman sila. And then I also teach their relatives and their friends, their family members on the proper way. No? Yes, so I asked them to take to video how to properly do the bandaging.
Oh, kasi hindi lang naman yun basta ikot ng ikot eh. What do you do 3/4 I think or?
Yeah, there's a certain technique, and you also have to know the proper pressure. Dapat medyo matigas dito, and then gradually naglalighten siya para umakyat siya. So ito na halimbawa yung shoulders, and this is the head. So and then the chest is here. So usually mag-aano na siya, magpa-flow back na siya to the other axilla. So that's number 2, no, compression therapy. Now, the third one, isa sa mga importante is skincare.
Yes.
Just like what you mentioned earlier, people who develop this condition can also develop skin problems. Kasi I always try to tell my patients, our skin can only be stretched to a certain limit. So every time your arm gets bigger, nasi-stretch yung skin, and merong mga microscopic butas yan wherein pwedeng mapasukan siya ng infection. So I usually would recommend my patients to use their favorite lotion or extra protection, especially yung mga ibang patients natin na active sa animals, may mga dogs, nag-gardening. So kailangan natin ng extra protection dyan. So skincare is very important, no? Pati sa nails nila. And most of my patients also, well, some of them are also post-radiation patients. So nadagdagan pa. You're not only managing your arm with putting in lotion and stuff. You also have to manage the radiated area.
The radiation burn. Oo nga.
Oo, kasi masakit din daw yun eh. Diba? Yeah. So, and we also wanted to restore the integrity of the skin the soonest time possible. So I suggest them to use certain lotions. And the last component for the management of lymphedema is lymphatic exercises.
Oo nga.
Yes. So lymphatic exercises is really more of hand movements and shoulder movements if we're talking about the upper extremity. So when we're talking about lower extremity naman, it's going to be really more of walking. And of course, while you're doing all those exercises, I do recommend that you wear your compression garments para may pressure pa din siya. So if you combine all of those, there's a great chance that the size of your limb, your arm or your leg would reduce, and you can actually go back to your regular daily activity.
So passive and active.
That is correct.
Range of motion. Okay, yeah. So everyone know we have to do some massages, but there's a technique to it and compressions. But so ayan, we need lymphedema therapists to help us on that. So yun ang cancer. We really need a team, diba? Maraming kailangang doctors, not
True.
just your oncologists and surgeons. There are a lot of people. Your oncology nurses help you. Lymphedema therapists help you. Ako as derma-oncologist, I also help cancer patients with skin problems. But the good thing with lymphedema, yun si Francis is not just handling cancer patients, right? So what do other things that lymphedema specialists do bukod sa cancer?
I think I spoke more about the upper extremity, like what I mentioned earlier, more of mastectomy patients. There are still other cancers wherein a patient can develop lymphedema. Cervical cancer, for the lower extremity.
Yeah. So pwedeng mamanas pala, the legs can have mamanas.
Yes, doktora. Cervical cancer, prostate cancer in men, yung mga na brachytherapy.
Yeah.
Yes.
So
anything that can damage their lymph nodes.
Circulation is really compromised.
True.
Nice.
Trauma also can cause lymphedema. In fact, I've seen a few pediatric patients as well. No? Ito naman yung tinatawag natin na primary lymphedema. So, defined as a lymphedema with no real cause. So, nag-develop lang sila ng swelling, maybe because of their lymph nodes are not functioning, their lymphatic vessels are too many, pero hindi naman gumagana. And these patients, as young as 0-2-day-old babies can develop this condition.
Oh my!
So prone din sila mag-develop ng infection or cellulitis even at these very early years of their life.
Oh, that's one thing, yung cellulitis. Patients with lymphedema are prone to cellulitis. Kaya ingat magsugat. So if you're cutting your nails, make sure na hindi masusugatan yung area. And then we mentioned skincare, putting moisturizers kasi improve skin integrity. Ibig sabihin, pinapatibay. Kaya yung sinabi ni Francis na nasi-stretch yung skin dahil sa lymphedema, mas nagiging pliable yung skin kapag naglalagay talaga ng lotions. Oo, kaya do take care of yourself, diba? Once if you're a cancer survivor, tuloy-tuloy pa rin yan. Alaga pa rin siya sa sarili. And if you have, for cancer patients here who's having concern with your lymphedema, Francis, where can they find you?
Oh, they can go to my Facebook page, which is the Southern Tagalog Lymphedema Clinic. My cell phone number is also specified there. They can send me a message through Viber, and they can also send me a message through the Facebook itself. Yeah.
Nice.
I would be glad to reply to you as soon as time possible.
Very accommodating yan si Francis. He'll be ready to help cancer patients because that's what we're here for. We want to have you the best of care as possible. Okay, maraming salamat, Francis, for guesting here at #Hope Series, and we really want to provide more hope for cancer patients out there. Maraming salamat.
Thank you very much, Doctora.
Thank you for watching #Hope Series. We hope you enjoyed this episode for cancer patients, and for those breast cancer patients watching, remember to take care of yourself and take care of yourself through skincare. Also, now check out Skincare for Hope's chemotherapy, skincare bundles, radiation therapy bundles, and hand and foot care bundles, bringing hope and healing to your skin. Now, to catch all the latest from Skincare for Hope, you can follow us on Facebook and Instagram at Skincare for Hope, or visit our website, www.skincareforhope.com. Thanks again, and we'll see you next time.